Your Excellencies, distinguished ladies and gentlemen, the global community is facing a number of serious challenges, including climate change, COVID-19 pandemic, rapid population growth, persistent youth unemployment, and environmental issues such as soil degradation. Smallholder farmer families are among those most vulnerable to the impacts of these challenges. It is therefore critical to improve the food, nutrition, and income security of smallholder families by creating resilient and sustainable food systems in low and middle income countries. In Africa, poverty-related factors, food insecurity, and infectious diseases persist, while drought, floods, and protracted humanitarian crises continue to increase the double burden of malnutrition. Of the 34 countries that account for 90% of the global burden of malnutrition, 22 are in Africa. The prevalence of vitamin A and iodine deficiencies, inadequate zinc intake, and iron deficiency anemia is highest in Africa compared to the rest of the world. The number of undernourished people in sub-Saharan Africa rose from 181 million in 2010 to 239 million in 2018, with a prevalence of 20.8%, albeit partly reflecting an increased population. Most of the world's stunted and wasted children are found in Africa and Asia. Globally, there are 149 million stunted children under the age of 5, a figure that has fallen over time. However, in Africa, the number of stunted children has been rising steadily over time and reached 58.8 million in 2018. In the same year, nearly 50 million children under the age of 5, representing 7.3% of the total, suffered from moderate to severe wasting worldwide. In Africa, the number was 14 million, representing 7.1% of children. Meanwhile, obesity is now recognized as one of the most important public health burdens facing the world today. 40.1 million children under the age of 5 were overweight by 2018. Of these, 9.5 million children are in Africa. One of the underlying causes is the commercialization of food production, processing, and distribution, which is correlated with a decreasing number of smallholder farming families, poor dietary diversity, and increasing household dependence on purchased food. The increasing consumption of processed food and reduced physical activity are among the key drivers of this increasing double burden of malnutrition in Africa. The negative effects of low agricultural productivity also prevent communities from achieving their full potential because it makes them predisposed to poverty and malnutrition. The resulting lack of essential micronutrients in their diets leads to high rates of stunting, anemia, blindness, weakened immune system, and vulnerability to diarrhea and other infectious, as well as physical and cognitive developmental impairments for children and adolescents. The recent UN Food System Summit aimed to fast-track the implementation of the Sustainable Development Goals, with a key element being food system transformation. The Sustainable Development Goals aim to end all forms of hunger and malnutrition by 2030, making sure all people, especially children, have sufficient and nutritious food all the year round. The Nutrition for Growth Summit builds on the results of the recent UN Food Systems Summit, which identified ending hunger and malnutrition as one of the priority actions for investment, finance, and trade. Improving nutrition through agriculture is a necessary and proven response to the global nutrition challenge. It is a holistic approach that combines nutrition-sensitive agriculture with regenerative and market-oriented approaches in a complementary manner. A priority goal for food systems transformation is to make healthy diets accessible and affordable to all people, regardless of demographics, income level, or location. Vulnerable smallholder farming families in rural areas of Africa, Asia, and Latin America depend on agriculture for their diets and their livelihoods. They are strongly represented among the estimated 3 billion people worldwide who cannot afford diverse, healthy diets. The concept of delivering essential vitamins and minerals through nutrient-dense staple food and crops, an approach known as biofortification, is a highly cost-effective way of addressing micronutrient deficiency among these smallholder farming communities. The process of biofortification has gained considerable traction in low and middle income countries since the first varieties were released to farmers 16 years ago. There are now nearly 400 biofortified crop varieties of 11 common staples available in over 40 countries, reaching about 10 million farming families. But this barely scratches the surface of the need for them among rural communities. This proven practical, cost-efficient, and complementary nutrition response is ready for rapid scale-up to help achieve the global nutrition targets, objectives, and commitments. The Copenhagen Consensus, a leading global development think tank, ranks biofortification along with other food-based approaches and interventions that reduce micronutrient deficiency among the highest value for money investments for economic development. It is thus imperative to scale up nutrient-dense crops and biofortification to help contribute to achieving several sustainable development goals. Endorsements and new commitments by national governments, multi-sectoral organizations addressing the nutrition sector, the private sector, donors, and global institutions are needed to mainstream biofortification within crop and food systems and make these crops readily accessible to smallholder farming communities. We need integrated efforts that strengthen each node of the agriculture value chain, from seed to plate. We need to prioritize biofortified crops in tackling malnutrition and hidden hunger through policy interventions and funding commitments that strengthen innovative technology development, delivery approaches, and capacity enhancement. For example, here in my country, Nigeria, the federal government and several state governments have made strong commitments to scaling up biofortification to benefit the country's more than 38 million smallholder farming families. Through integration of biofortification in policies and promotion of biofortified crops in seed and food value chains, the benefits of these nutritious varieties are reaching many more farming families and consumers. It is a model for other countries to follow. I urge the stakeholders and donors participating in this Nutrition for Growth Summit to prioritize investments and policy commitments, ensuring that the global community can reach the global targets to reduce the prevalence of stunting, wasting, anemia in women, and prevalence of low birth weight, with additional focus on ending poverty and addressing inequalities. This requires international cooperation to ensure investments that include training and support for relevant stakeholders on sustainable agricultural practices, processing and consumption of nutritious crops, agribusiness, and on food diversification and gender-sensitive awareness raising on nutrition. Bio-fortified crops should play a key role in efforts to foster a healthier and more productive global community. Thank you for listening.